Do you want to know some facts? Let me read them to you. About 68,000 deaths are due to people not having health insurance in the United States. I think it is more than that, but 68%. The healthcare spending by Americans is at least twice that of comparable countries in the world. So you and I, what we spend on healthcare is at least twice what citizens of other comparable countries, like the Western European countries, spend on healthcare. There was a study that was done by Commonwealth Fund, and it looked at 10 comparable countries of the world, mostly in Western Europe and Australia, including the United States, and it found out that US comes 10th in terms of worse health outcomes, and yet we spend more than twice what these countries spend on healthcare. They also did a study of 191 countries of the world. So now 191 countries of the world means that both developed and underdeveloped countries or global south countries. And they looked at their healthcare system. The United States came 38th of 191 countries in terms of healthcare, quality of healthcare, and healthcare outcomes. And yet, we spend at least twice what these countries spend on healthcare. Do you know how big medical tourism has become in the US? Medical tourism, where the US citizens go to other countries to seek healthcare because it's cheaper, the quality is the same, the equipments are the same, nothing else. And yet, they get these procedures done cheaper, faster, and more reliable. They go to countries like even Vietnam, Thailand, Mexico, of course, we've known that. They've tried Canada. Now they're all going to China for medical tourism. Same quality, same equipment, same great hospitals, same great healthcare professionals, but much, much cheaper. Did you know that at least 15% of your healthcare spending goes to administrative spending? There's one study I saw that says that there are 10 administrators for one physician. So you're paying more for paper pushing, for bureaucracy, than you're paying for the actual treatment or service. Getting sick in the US is no longer just a healthcare crisis. It's a financial nightmare. From skyrocketing insurance premium to surprise billings and medical debt. The high number of bankruptcies due to medical debt is alarming. We have seen those two dreaded words, prior authorization. So in other words, You have a medical issue. You want your doctor recommends a certain medical procedure. It has to be approved by someone in an office. The doctor recommends a certain medication. It needs to be approved by someone in an office. That person is not a healthcare professional. That person does not even have a healthcare degree. That person is looking at one thing and one thing only: costs. Did you know that Americans spend on average about $1,600 per person for prescription drugs? In other words, we spend more on prescription drugs than any other country in the world. In fact, inpatient and outpatient care are the highest. So pray you don't get admitted in the hospital, because even the towel, the plates, everything you use there, you billed for it. And pray you never have the surprise billing. There will be so many bills from all over, one specialist or the other. You better read your bills properly. 1/3 of Americans lack access to primary care. And there's a reason for it, you know. Most physicians do not go into primary care because there is no money in it. Do you blame them? They go to school for maybe 7, 8, 9, or sometimes 10 years, and you want them to be primary care physicians where they earn nothing, but then they have maybe $400,000 student loans. So mostly they will want to go to the specialties where they can be paid well so that they can pay their student loans. And there are no student loan forgiveness. You're on your own. At least 38% of Americans delay medical care due to costs. Most Americans don't even have up to $400 emergency savings. You better pray you don't get into a medical emergency. In America, there are 252 physicians per 100,000 patients. So in other words, there are not enough physicians to go around. Sometimes people have to travel long distances just to see a physician. Only about 12% of physicians are primary care in the US. I applaud them. Many of us who have insurance are mostly underinsured. In other words, yes, you have insurance, but it only covers a few things. And your spending is capped, so that once you hit that cap, everything comes out of pocket. And many Americans are forced to buy junk insurance. The number of uninsured people in the US is at least 26 million. You want to put that into context? Maybe the size of Australia. The average family insurance cost is at least $25,000. So if you earn $100,000, a quarter of it goes into health insurance. So the other quarter has to do with you either paying your rent or your mortgage, your feeding and whatever. So that's a lot of costs. How many people can really do that? And how many people earn $100,000 or more? These are some of the statistics that we're looking at. But there are things that can be done if the government wants to do it. But do they actually want to do it? I will share here what one of our congressmen says about health insurance, because many times they pay lip service, but they do nothing. Sorry, Hakim Jeffrey, but I have to play this.
Move on to Medicare for All. You co-sponsored Medicare for All legislation from 2013 to 2021. You've not co-sponsored it since you became Democratic leader. Will you put Medicare for All up for a vote if you become Speaker?
Well, listen, these are all conversations that the House Democratic Caucus is going to have. Right now, we're focused on November 3rd, not January 3rd.
You see, these guys are smooth talkers. Just so smooth. See how he sidestepped that question? Just elect us first, and then we'll have the conversation later. Just place your ballot and say, yes, we will control the Congress. And then we'll talk about that health care. And by the way, we're fighting for you. Let's continue.
What we are promising the American people is that we're going to fight to make health care affordable for every single American.
See what I mean? They always fight, but they never win. People are playing with us.
And we know there's a lot of damage that Republicans have done that we've got to restore and repair. For instance, Republicans have enacted the largest cut to Medicaid in American history. More than $1 trillion or so has been cut from Medicaid, and what you're going to have is about 14 million Americans lose access to health care.
That I agree. Cutting of Medicaid, that is brutal. But it's so interesting. Many of the people whose Medicaid are going to be cut voted for this. I think maybe because many times we vote against our own interests. We vote out of emotion. We don't vote out of knowledge. We vote out of emotions. And these politicians know it. And so they use it against us. They whip up our emotion. Whip up. They have their go-tos. Second Amendment, the border, immigrants, the liberals, MAGA. But they're all the same. They belong to the same clubs. Many of them have stocks in the healthcare industry. Do you think that they're going to do anything to change the system that works for them? Many of them have stocks in the defense industry. Do you think they ever want those wars to stop? We have to open our eyes. We have to understand their game. They're playing with us, and we just don't get it yet. Let's continue. Hakeem?
That
Personally
has to be
support Medicare for
reversed.
all? Do you personally support Medicare for all?
No, as you indicated, I haven't co-sponsored the Medicare for All legislation that has been introduced over the last several years. I do think we need to figure out how to fix our broken healthcare system and then build something better once we repair the damage that has.
Interesting. Amazing. Don't support Medicare for all. I'm not saying I support Medicare for all because I do think everyone needs to have a skin in the game. Nothing comes for free. But how long will you continue to try to fix this so-called broken healthcare system? You have been saying these words. Let us fix this broken healthcare system for decades. And you have not done anything. Hakeem, I'm sorry. I can't listen anymore. It's driving me crazy. So there it is. But we have the power. There's nothing stopping us from finding and voting for the people who will advance our interests. There is nothing stopping us from doing that. Let's work at it. Because while we're busy watching TV, they have found out that they can make you sicker. You know, in the sports games like NBA, Super Bowl, Olympics, World Cup, look at the ads. Look at the ads. They first advertise you foods that will make you sick. Then the next ad will be for a pill that can get you better. And after that, they advertise you a car that you can drive because you feel better. It goes on, and we are glued to it. We are being hypnotized by it. And then they top it off by advertising you beer. Oh yeah, you need that. After all, it's the game. You sit on that recliner chair with your big tummy, you enjoy the game. And once you finish drinking that six-pack, you run to the hospital. On and on and on and on. While that is happening, they are busy merging the doctor's offices, the hospitals, the insurance companies, the pharmacies. They are merging into one big entity because there's something that they have realized from the 2008 financial crisis. The only way to survive is to be too big to fail. So they hold us hostage. They hold the government hostage. There'll always be a bailout. But you, the citizen, don't get that bailout. You, the citizen, you don't get that bailout. So subscribe to my channel. Hit the like button. And let's start to think clearly. Let's start to take our own lives in our own hands, because nobody will do it for us. Subscribe to my channels, hit the like button, leave comments if you disagree or agree. I'd love to hear from you. I'll see you next time. Bye.